On behalf of Scottish Labour, I want to begin by thanking all of Scotland's healthcare staff for their service to our country during this awful pandemic. Covid-19 has crashed into our lives and made us all less certain about the future. We can be certain, however, that we will always need the National Health Service. If the NHS had not been created by Labour 72 years ago, we would be at the front of the line today calling for its creation now, so that healthcare free at the point of need is universally available to all of us. There's no getting away from the fact that this global pandemic is presenting enormous challenges to healthcare systems right around the world. And that is why we welcome today's debate on the Scottish Government's Remobilise, Recover, Redesign framework for NHS Scotland as an opportunity to address the challenges facing our health and social care services in the short, medium and long term. For the past 11 weeks, the NHS in Scotland has been on an emergency footing, and we've seen what life is like when parts of the health service are in lockdown or simply not available to us. And we understand why there had to be an immediate focus on freeing up capacity and planning for the worst case scenario. And the Scottish Government has never tried to sugarcoat this drastic decision. Ministers and officials have always been clear that the virus would cause direct harms and indirect harms. Despite every effort to protect the NHS and save lives, tragically, Scotland's deaths have contributed to a devastating picture across the UK, where collectively our death rate is believed to be one of the highest in the world. The high number of non-COVID excess deaths, around 915 since the middle of March, has prompted the Scottish Government and the Chief Medical Officer many times during the past few weeks to ramp up the message that the NHS is still open. And we all know constituents and people who have been worried to see their doctor about changes in their health, whether it's lumps or unusual bleeding. So it's been good that we've heard those messages coming directly from government, but we have seen a huge reduction in urgent cancer referrals, and we know that's because patients have been staying away. We see this too in A&E, where attendances have remained historically low throughout the lockdown periods. Urgent treatment is supposed to be continuing, but we all know constituents who've been unable to access urgent medical treatment. And earlier today, official figures have confirmed that the number of planned operations was down by over 80% in April, while over a third of children and young people waiting to be seen by CAMHS have been waiting longer than 4.5 months. So we know that we're storing up a backlog of health problems. But in terms of some of the immediate priorities, Miles Briggs has mentioned a couple of the briefings that have come in, and I think we've all been speaking to the same stakeholders and organisations in recent weeks. So I think there will be a repetition in terms of the themes today, but if I begin by speaking about cancer, because we know that cancer is the leading cause of death in Scotland, and before COVID-19, around 34,000 new cases of cancer were diagnosed in Scotland each year, and sadly around 16,000 deaths to cancer. So cancer won't stop simply because of this pandemic. And I agree with Cancer Research UK. In fact, I support their campaign, Safe Spaces for Cancer Services. And the disruption to cancer testing and treatment, we know, could have potentially devastating results for people's survival. And I know that Macmillan Cancer Support, as I look around the room here to all the briefings that I have pinned up, I know that these are issues that matter deeply to our cancer charities who do fantastic work all year. But the Parliament heard evidence from Professor Linda Bald a few weeks ago now, and I've mentioned this to the Deputy First Minister when he's appeared at the COVID-19 committee, and she has made clear that staff stand ready to deliver once again the cancer screening programme. But we need to factor in access to PPE, and we need to factor in testing and screening for patients. I would really like to see more detail on how the Scottish Government is going to get our staff ready and safe working environments, because we do need to have safe spaces to get life-saving services around cancer up and running. And I do agree that we need to make mental health a priority. The RCN Scotland have set this out helpfully in their briefing, and I do agree with them that the framework at this stage is a little light on detail, but I think that's particularly true of mental health services. So I think we have to work collectively to get that right. And the Cabinet Secretary will be aware that I wrote to her recently about further clarity on mental health support for staff and a plan to address the risks and harms associated with post-traumatic stress disorder. And I see that BMA Scotland of doctors said that they're suffering from anxiety, depression, stress or burnout. And I think there is a real cross-party consensus building. I think members across the chamber, we see it through the cross-party groups that we're members of, but I think there is a real willingness to support the government's effort, to support the national collective effort. And I think rather than the cross-party groups being seen as something that sits outside Parliament and we come to the Cabinet Secretary with a list of problems and challenges, I think we all want to see closer working so that the opposition parties can work alongside the government when these frameworks and plans are being worked up. But Miles Briggs is right to highlight the challenges facing chronic pain patients. Again, these are issues that have been problematic for years, but we heard testimony from patients who have been feeling suicidal because they're completely isolated, they're completely shielded and not in contact with anyone, so are unlikely to have the virus, but they can't get these infusions and injections that Miles Briggs referred to. And again, I pay tribute to the cross-party group on cancer. I'm sure my colleague Anna Sarwar will speak more about the work that him and Miles Briggs have been leading there. So there is that appetite to work across party boundaries. But Scottish Labour is completely realistic. We know that in terms of recovery planning, it's not possible to resume all NHS services overnight, and it does require weeks and if not months of careful planning, and we want to work with the government on that. The Cabinet Secretary was right to say that the NHS doesn't exist in isolation, it can't work alone. I wholeheartedly agree, and that's why I'd like to see more certainty for charities like Chest Heart Stroke Scotland, who have a fantastic hospital at home programme, but at the moment they only have financial support from government for up to a maximum of 3 months. So we need to know what support will be in place so that charities can health charities in particular, can plan for the longer term. In conclusion, Presiding Officer, there's so much to say and there's no time left, but I mentioned the National Health Service and the values that underpinned that those 72 years ago. In this debate, I've not had time today to talk about the impact on older people and the fact that our care homes remain at the centre of this crisis. We need a national care service. We need to have consistency in terms of standards and quality and access right across Scotland. And never again can we have a situation where people are cleared out of hospitals without proper testing and screening and into care homes where health support has not been available. I look forward to hearing more from the Cabinet Secretary on that, but we have to remember that in this crisis that health and care workers have also lost their lives and have become unwell in this crisis, and we all have to work for their benefit and for the benefit of all patients in Scotland to make sure that we learn lessons quickly and don't take questions or criticism in any way as a negative, but as an opportunity to do better for the future. Thank you.